Technical definition of a nocebo is, it's a psychological or psychosomatic factor. Somebody comes into my office and they were told that they have a herniated disc. So they have a herniated disc, which means they should, and they have either been told or come to believe that that is the cause of their pain. They should not move. They need to protect it. They shouldn't do certain activities. It's always going to hurt. It's going to get worse. They might need surgery. They need injections. And those are kind of the nocebos that start to pile up. When the fact is, it's very common for people to have bulging or herniated discs and no pain at all.
Sometimes in the holistic medicine world, we get a bad rap for this placebo effect, right?
Mm-hmm.
You believe you're better, so therefore your pain goes away. It's not really having anything to do with what the treatment was. And what you're referring to is literally the 180-degree flip side of this, which is that you can also create a belief that there's a problem when perhaps there's not really the level of problem that your mind has created and is holding on to, which is literally holding you in pain. All right, welcome back, everybody. This is our video series with collaborating with healthcare professionals in the area. And this is Ryan Diener with Holistic Health Associates, and I am super excited to have Deborah Morrone, Doctor of Chiropractic at the Frederick Chiropractic Wellness Center, with us today. Deborah and I have been working kind of parallel universes here in Frederick, and have not only started around the same time, but have lots of people that see us both for various things. And acupuncture and chiropractic, as many people know, are so beautifully intertwined and work so well in conjunction with each other. So it is an absolute pleasure to have you on here. So thank you so much for being here.
Well, thanks for letting me join. I'm looking forward to it.
Absolutely. Absolutely. So everybody that is watching now, please take a moment to like, share, comment on this video. It helps us continue to bring great content out to you and continue to do these interviews with great professionals in the area. So please do us that favor, and we would greatly appreciate it. All right, so let's get into it, Deb. So today we are going to talk about the limiting beliefs that we face in our health, in healthcare in general, and what is known as the nocebo effect, which we'll get to in a minute. But just start with the phrase limiting beliefs, and why as a chiropractor and why as an acupuncturist, that's important when it comes to helping our patient base.
Limiting beliefs. So many people come to see us alternative practitioners as almost a last resort. It happens so often. They've been everywhere. They've done everything. They've been to the PTs, the orthos, the neuros, and they're still sick. Their bodies are breaking down, and they come to us with anxiety over that. Like so we talk about placebo effects, right? So we all know what a placebo effect is. Somebody tells you that something is going to work, and it works, in part because you believe that it will. But the nocebo effect is kind of the opposite. It's those beliefs that we've developed over time, either from being told that we're just getting old, we're broken, that your body can't heal, or it hasn't healed because you haven't approached it from the right direction. But that nocebo effect can be very powerful as well. And breaking through that and getting people to understand that, yes, your body can heal, it can get stronger, it can get better despite the pains and aches and injuries that you've had. It can be a challenge. So that's a lot of times where I have to start with my patients, is breaking through those limiting beliefs. It's like, you're still alive and kicking, so you can get better. Let's figure out how to make this work.
Yeah, I love this. I love this as a topic in and of itself. So many of these times when we do these videos, like we want to talk about a condition and why chiropractic works for XYZ, why acupuncture works for XYZ, and all that is super helpful. But I mean, to your point, the vast majority of people that we see not only come in as either a last resort or because they just want some sort of natural healing. But there can be kind of a resignation in the beginning of that process, like, well, I'm just going to try this because I've tried everything else, and I'm going to be able to check this box and say, well, I tried that and it also did not work, right? And it's almost like there's a preconceived notion that this too will not work. And so talk for a moment about why, this becomes part of your job and not the job of a psychologist or a psychotherapist in this situation. Like, why do you see this as part of what you do and not something to refer out?
Mostly because, again, people have been so many places, they've done so many things, they've had so many negative experiences with getting better. I almost have to dig in to understand where they've been, what they've done. And if something hasn't been working for them, for example, if somebody comes to me with a shoulder problem that they've seen all the people and done all the things for, guess what? I might not be looking for that shoulder. I might be looking elsewhere. So, looking at the big picture of how they got where they are, looking at their history, looking at what they've done, what they have not done. That's a big part of where I'm going to start with my treatment, no matter which direction we decide to go with it. It's not always just a structural problem when we're dealing, especially with people with chronic pain and injuries. All those other factors need to be brought into play. So it really does guide where I'm going to start with them, what we're going to evaluate, so we can figure out the best route to start getting them better.
Yeah, it's beautiful. I mean, I think it really speaks to the heart of holistic medicine in whatever form you're practicing it in. So whether it's Chinese medicine or acupuncture, whether it's chiropractic, whether it's functional medicine, whatever we're talking about from the point of view of a holistic perspective can come into terms of, you have a physical body that has a hole. So to your point, like your shoulder is still bothering you after all these different shoulder treatments. You may need an adjustment in another area of your body in order to balance out some sort of blockage or, inhibition in the shoulder. But in addition to that, holistic medicine can also be the relationship between your emotional body and your physical body, and the level of stress, the level of anxiety, the level of negativity that you are already, in your prefrontal cortex, that pre-thought process can literally change the way that your body responds to care. And so, so in a given situation, you may want to refer out if it's something that is so psychologically damaging. But sometimes what we see is just connecting those dots for people is something that's like an epiphany, because no one's ever done it before. Is that something that you experience as well?
Absolutely. And that's my favorite thing to do. It's like, okay, talk about stress issues. People, if you ask anybody, where do you carry your stress? Everybody's going to have an answer, right? Oh, I clench my teeth. It's in my shoulders. I get headaches. My digestion gets all wacky. All of these things, we know that mental and emotional stress can trigger physical symptoms. That's almost a given. And once you point that out to people, are like, oh my God. Sometimes I do need to refer if there is some serious, if they're having some serious family or work or whatever kind of emotional stress going on, yes, I'm going to refer them to some of my psychotherapy friends who understand that and can help them work through it. And a lot of times that's kind of like the thing that starts unraveling the whole issue. But, again, people come in, it's like, okay, we know what hurts, we know what it feels like, but why is it there? What got you to this point? And that can be a deeper dig. And, it's not unusual as we start, I call it peeling the onion. It's like, okay, we start here, pick the low hanging fruit. We know we can start making this better, but as we go through the process, then we start to figure out like, oh yeah, by the way, I did fall out of a tree when I was 10 years old. And, this, or, oh, I forgot about that car accident that I had 3 years ago that might be adding into the pile that we need to sort through. Your body remembers everything you've ever done to it. And sometimes those things heal or they feel better, but the underlying trauma and drama is still there, and it can be triggered by all kinds of weird stuff.
For sure. And I think to that point, when you've had some sort of physical injury, which everyone has had at some point in their life, right? You can't get through life free of something, or else there's other challenges that we're going to have to deal with if you've avoided everything in life, right? But the fact that you've had some of these challenges along the way, and then it influences the way you think about not only what the result of that was, but what it means for your ability to get better, to heal, to what degree. So let's dig into that a little bit. Like what the deeper component of this, what you called the nocebo effect, right? This so define nocebo effect first as it relates to like the concept of limiting beliefs, and then let's dig into it a little bit deeper as to just what we can do and why it's so important to be incorporated into this first phase. Like what are the actual steps that you do to deal with it? I mean, obviously it's pointing at things that we talked about, you know what I mean?
You said we have 15 minutes, right?
Yeah. We can go a little longer, don't worry.
So, technical definition of a nocebo is, it's a psychological or psychosomatic factor. It's like, okay, I'm going to use a basic example that I see a lot. Somebody comes into my office and they were told that they have a herniated disc. So they have a herniated disc, which means they should, and they have either been told or come to believe that that is the cause of their pain. They should not move. They need to protect it. They shouldn't do certain activities. It's always going to hurt. It's going to get worse. They might need surgery. They need injections. And those are kind of the nocebos that start to pile up. When the fact is, it's very common for people to have bulging or herniated discs and no pain at all. It's not, but, that's what gets set up is, when they strain their back, they go see their doctor. Their doctor sends them for an MRI. Their MRI says they have a bulging disc or degeneration. And one of my first comments on that is usually, you had that before you strained your back and had these symptoms. So, it becomes breaking that down. It's like, are these structural problems actually causing the pain? Maybe. Is that just a sign that it's an area that's been stressed and traumatized before? Probably. Is that just a sign that we need to figure out a better way to keep it working and strong and healthy? Definitely. So, when people come in with those nocebic beliefs around an X-ray or an MRI, again, just to use that as an example, because that's what I see pretty much all day, every day. Like, break it down. It's like, why is that there? Is that the problem? Maybe, maybe not. And what can we do about it? And, just start giving them the suggestion that, yes, there's something that can be done about it. Is it going to go away? That degeneration? Probably not. But will it always be a problem? Maybe, maybe not. Do we just need to learn to manage it better? Definitely. When we're dealing with problems like that, the best, all the current research says the best approach is to get it moving and keep it strong. So how do we do that?
Yeah, it's great. And I love that there's an actual term, nocebo. I mean, this is like the first I've heard of that as an actual word, but it obviously makes sense, right? We sometimes in the holistic medicine world, we get a bad rap for this placebo effect, right? You believe you're better, so therefore your pain goes away. It's not really having anything to do with what the treatment was. This is kind of like an ongoing kind of cynical theme around holistic medicine. Right. And what you're referring to is literally the 180-degree flip side of this, which is that you can also create a belief that there's a problem when perhaps there's not really the level of problem that your mind has created and is holding on to, which is literally holding you in pain.
Yes. Yeah. And, we talk about the effect on the nervous system. Going into the placebo effect I don't think it's necessarily a bad thing. I mean, if I can shift somebody out of a stress, fight or flight, my body is broken and I'm afraid to do anything, into, oh, I can breathe, I can relax, I might be able to do something about this. Shifting that mindset is absolutely key and is absolutely real in them deciding to get better. Yeah. We all know what the effects of elevated stress will do to you physically, chemically, emotionally. It inhibits healing. It screws with your immune system. It raises your blood pressure. It messes with your digestion, and all of those things affect how your body heals and functions on a day-to-day basis. So yes, a lot of, I call what I do is end up being stress management to start with, like teach them to breathe, teach them to move, teach them to calm down so that they can start to do the things that they need to do.
Absolutely.
Or at least see that tiny little, beam of light at the end of the tunnel to get them moving again.
Yep. Yeah. Look, it's absolutely true in my experience that most people have a predisposition towards negativity in their thinking, and that's not their fault. Like,
right.
We have a culture that has basically set us up for seeing the worst possible case scenario. We have a historical kind of, biological body that was built to be able to get out of situations that were, whether it be through manipulation, whether it be through, connection with someone else, whether it be through running away, whether it be through fighting, whatever it is, we are built to avoid pain, right? To get away
built
from
to survive. Yes. It's a survival mechanism.
Yes. And so there's this kind of negativity that pervades all of our experience. And then you go and watch the news, or you watch, anything that is just like trying to get you, your social media feed, it's trying to get you to pay attention to something. It's always going to be something that, more often than not, is something that you go, oh, I have to read that. What happened there? It's a problem, right? Yeah. This is a common thing that we see. And so you're already predisposed towards worst case scenario. And so, we find that in the treatment room, pointing out where people are actually getting better, that they're not even recognizing, is so important. Right. It's almost like that speaks to the counterbalance to the nocebo effect that you're talking about, because it's like you have to train almost your own thinking into realizing, hey, it's actually okay that things are going well for a change.
Right. Or, they come in after a few visits like, well, it still hurts. I'm like, but look, you're moving better. This muscle is stronger. You're sleeping better. It's like, okay, yeah, the pain is still there. Your brain is still kind of protecting it. There's still something going on there, but all these things are starting to get better, which means we're moving in the right direction. I always just tell them different is good at, especially when we're starting out, looking at, again, going back to looking at how the whole body is working. Sometimes I go digging and find old injuries that they forgot about that are directly affecting that new spot, or that spot that they're complaining about. So yeah, we're always focused on what still hurts. It still hurts. I still can't do this. I'm like, well, you've had this for 10 years and we've been at this for 2 weeks. Let's give it a little bit more time.
Right.
What is better? Focus on what's good, what's better, what's working.
Right. And what's your take on when pain arises? In other words, do you feel that pain is where does that come on the process of physical disruption, and when and what's the goal? Like give me kind of like your philosophy on how, what is pain and what do we need to do about it? You know what I mean?
Yeah. What is pain? Yes. Sometimes pain, sometimes it's very obvious. I fell down the steps and I strained my back, or, I tripped on the curb and I rolled my ankle and now it hurts. But sometimes I get the people coming in who are like, I just bent over to tie my shoes and now I can't stand up straight. And I've been like this for 2 weeks. Like I didn't do anything. Like, but, then we start asking questions like, well, what were you doing before that? What were you doing before that? Have you had these type of injuries before? Again, so going through, how did the pain show up? Again, physical, chemical, emotional stress. If there wasn't a specific injury, we need to go digging a little bit more to figure out what may have set them up for that. Yeah. And sometimes it's obvious, sometimes it's not. And sometimes we're just like, okay, we don't know. Let's start with where we are. What hurts? Why does it hurt? And what can we do to start to make it better?
Yeah,
we need to.
Sure.
Yeah, I mean, but where pain starts, again, it's sometimes obvious, but when you're dealing with chronic pain or multiple injuries or multiple illnesses, or, that's a much, much bigger, deeper question. And that's where we get into the physical, chemical, emotional, and start start kind of developing the team to make it work, whether I need to send them over to you guys or send them to the therapist or send them for a PT, or sometimes there are some things that are just broken and we need to look at potential surgical intervention just to put them back together.
Definitely. And that's where this collaboration is so valuable, knowing that there's some variations of strength from one modality to another, but also that there are certain people that just seem to respond to certain modalities better than others. And we don't know why. We have no idea why that is. There's so many times that
I feel like I have a handle on something. And sometimes we just hit the wall. I'm like, listen, what we're doing is just not working. And I don't know why. Let's talk about who else might be able to help you. And most of the time they're being honest about it is absolutely key, instead of just saying, you're broken, you're just going to have to suck it up and deal with this. I think that's where things start to go downhill really, really quickly.
100%. And there's so much that goes with getting to the point where you're having some sort of physical ailment. The body is compensating for so long before you get to pain. You know what I mean? And then if you get out of pain, you might be like right here, but one little stressor and then boom, you're back into it. And people ask us all the time, why did it work for a while and then it came back? Well, it's because you came from here and you came all the way to here. And now we got you to here. It's only been a few weeks, like you said, and what we want to do is backtrack you all the way to the point where you have all this wiggle room. So you get some stress.
That's stress tolerance or stress intolerance, as you might want to call it. It's how did this happen again? I was doing so well. It's like, and then you ask a few questions like, oh yeah, I went on vacation and I ate a bunch of things and slept in a bad bed. And, now 2 weeks later, I'm still feeling it. It's like, okay. Or they had some sort of family trauma that stressed them out and messed with their sleep and their nutrition. It's like, but starting to teach I love teaching people and then starting to see the light bulb, seeing the light bulbs popping up. It's like, oh, wow, this is what happens when I'm stressed, or this is what happens when I don't sleep, and then they can start to take ownership of it. And when their body does start to give them the yellow flags, they can, start to get it under control themselves before they have to call me.
Yeah, definitely. So go into that a little bit deeper. How do you, when you talk to people and they say, I've got this herniated disc and it hurts to go from sitting to standing or standing to sitting. I know I should be exercising or moving, but I'm afraid, I don't want to make it worse. How do you start them? Give us kind of your start point with that.
Well, I'll go through and do a basic physical exam. We look for what we call the yellow flags and the red flags. So we look for those yellow flags saying, okay, this might be a problem. Obviously, we're looking for red flags like infections or fractures or tumors or, the nasty stuff that we definitely need to know we need to refer out for. But just going through, it's like, okay, show me what hurts, do that. Let's see what happens when you do that movement. It hurts for me to bend over and tie my shoes. Show me what that looks like, and then show me where it hurts. And then I'll go through a more detailed functional assessment, doing some range of motion, muscle testing, see if we can start to figure out where that trigger is coming from. What movement is hurting and why is it hurting? And can we start adjusting things throughout the body to start make it start working better? When it starts to move better, then it can get stronger. So I'll start with getting them on the floor and doing some basic yoga poses. Like, all right, let's start with movements that don't hurt and then start to kind of graduate them up to things that might start to hurt. But then we know it's like, okay, you can do this. It hurts, but we're going to work through this one. This is where we start.
That's great. It's so important, I think, for anybody watching to know that it's okay to go to the edge of discomfort when you're trying to heal. And one of the hallmarks of what we encourage people to do when they say it hurts to go from sitting to standing is to do that squat from standing to sitting right up to the point where you have pain, and then to come back up and then do it again, and then to come back up and then do it again. And it's like, the answer is not to eliminate the movement. The answer is to be able to work right up to it, and then help your body get this much better, and then help your body get this much better, and then help your body get this much better, and you'll eventually be able to do more, right?
Right. And that kind of leads into the next concept that I like to talk about with people is like, hurt does not always equal harm. Most people think it hurts, I shouldn't do it because I'm doing some sort of damage. That's not always true. Sometimes, I went to the gym yesterday for the first time in a couple of weeks because of the holidays. My body hurts. Did I hurt myself? No. Right. I just used muscles that have not been used that way for a few weeks, and I'm dealing with cleaning up my gut and all the sugar and crap that I ate over the holidays. Yeah. So it's like, I went, it didn't feel great, but I did not hurt myself. So using those type of analogies, like, you go to the gym, you haven't used this muscle in a while, you haven't moved this joint in this range of motion for a while. Does it make sense that it might feel a little bit sore and cranky when you try to make it move? Like, yes. If you start to use a joint or a muscle that's been weak and injured, is it going to hurt when you start to move it again? Yes, probably. But setting up that expectation that, this isn't necessarily going to be enjoyable, but, and starting to teach them, where the limits are. It's like, I usually use like, okay, if it's more than a 5 out of 10, if your body starts giving you sharp, crampy pains that say stop, listen to it. But then you back down to this type of movement and work your way back up again. Yeah,
totally true. I mean,
teaching them that it's okay to move even though it hurts. It's like, I use one of the phrases that we use, is it painful or is it just annoying? And if they're like, well, it's just annoying, then okay, you're fine. Keep doing it. Yeah. Annoying is fine. Pain is bad.
Yeah. And it's okay that people don't realize this, because I think it's more ingrained in us that, any kind of struggle is a problem. Any kind of, pain is a problem. This is, we want to, again, there's this underlying component of our psyche that is in avoidance of problem. It's like at all costs, we want to avoid problem. And it takes some recalibrating of your own position around this first in order to move it. I mean, we have a detox program that's starting, and the first thing that we tell people is expect to feel bad for a few days, and then expect to feel incredibly good. But your body has to clear this stuff out. You're gonna feel it. You're gonna be going through almost like a little withdrawal. That's not a problem. It's all expected. But if you don't know and you just do this on your own, and you don't have somebody that's done it before to say to you, hey, this is okay, that's a problem. And that's why I think what you were talking about earlier is so important. It's okay that that's part of our job as holistic practitioners, that we don't have to refer out every psychological conversation just because it's not our background or expertise. The deeper things, the things that don't have, that don't seem to be moving, absolutely, sure. But a holistic point of view means you incorporate somebody's mindset, physical body, belief system. All of that is so much ingrained in the picture. Yeah.
Yeah. And it's so much more than, but with our medical system, it's okay, go to the doctor, it hurts. Here's an anti-inflammatory and a muscle relaxer. Okay.
Avoid pain.
That might get you out of trouble. And sometimes that's necessary if somebody's, if it's affecting their sleep or their ability to, just function or go to the bathroom. Like if you can't sleep, then you're not going anywhere. But we also have to. That's not the solution necessarily. I had a new patient come in a couple of weeks ago, and she'd had 3 cortisone injections to her neck for a bulgy disc. And I'm like, have you done any kind of PT or rehab? What exercises or stretches have you been doing? She's like, I haven't, because it's still sore and I'm afraid to move it. So we had to go. So this is a classic example. We had to go back to that conversation. Like, well, if it doesn't move, how does it feel when you want to start exercising again? If it hasn't moved, what are those muscles going to feel like when they start to move again? Yeah. They're going to be sore. Well, you think they might be sore? Yes. Does that mean you shouldn't move? No. So finding out what their goals are. She wants to get back to running by the spring. I'm like, okay, fine. There's no reason why you can't. We just need to figure out how to get your body moving. But the first step to that was telling her it's okay to move.
Yeah, totally. It's like, you have to untangle enough.
Here's some movements you can do that won't hurt. giving them that confidence to actually start doing the things that they need to do. Is it a placebo effect? I don't care. I really don't care.
Yeah. Yeah. It's just about untangling the knot as a concept, as opposed to assuming that it's going to go from tangled to straight line. You have to sometimes spend some time getting the neck moving again, so. Yeah.
And then when they start moving that, they're like, oh, by the way, now this hurts. I'm like, okay, because you haven't been moving your head, of course that hurts. So now we need to go to the next layer. And, but it's like, you won't know unless you try. So, people like, well, can I start running? Like, go do a 15, 20-minute walk, jog, see how it feels.
Yeah.
If it doesn't feel good, then come back and report back. Tell me what's not working and we'll try and troubleshoot it again. So sometimes there is a bit of trial and error because there's so many different things going on. It's like, how are we going to best, start to access this problem? What can we make better to get you started? And then we can deal with the other stuff as it pops up.
Yeah, fantastic. Okay, so let's talk about that. When you say, what are we going to do to get you started? Because I know that having worked, side by side with you for the last 20 years or so, that we're dating ourselves, I know, but that you do not practice traditional chiropractic. When you say, I want to start someone, that doesn't mean, lining them up and cracking their neck and then sending them off. What does it mean to you as the type of chiropractor that you are / holistic practitioner to start someone? Well, you use many different techniques. And so just, give people the sense of what that looks like to come to you.
Yeah, over the past 20 years, I started out obviously doing the traditional chiropractic techniques because that's what they teach us in school. But as I started to progress and started, have some of my own injuries and own traumas and dramas, and it's like, okay, well, that's not working for me. Who else is it not working for? It's like, so a lot of what I've learned over the years, technique and approach wise, just it's mostly because I've been trying to fix myself. I'm sure you see that as well. It's like we go looking for solutions for ourselves, and it's like, oh, well, that made this better, so maybe I'm going to learn more about this and start using it in my practice. Like I said, yes, I do traditional chiropractic adjustments, but there's a lot of people who don't enjoy that approach, and it doesn't necessarily work for them. And there's a lot of reasons why that might be true. So I've shifted gears to using some more soft tissue techniques. I'm doing more movement therapies. I'm using more low force techniques that make the person more comfortable. Because if they come in and they're afraid to have their bones cracked or their spine cracked, they're going to be in stress mode. And as we have already discussed in great detail, stress mode is not healing mode. So just having all those different tools in the toolbox, again, what has worked for them in the past, what has not worked for them in the past. They've been getting, I saw a woman a couple of weeks ago. She was an older lady. She's in her late 60s. She's been going to chiropractors for years, but she was in a car accident a couple months ago. And she's like, you know what? I love my chiropractor, but his approach is not working for this particular problem. And she found me on a web search or something. And so, she had some tests, she had some MRIs and x-rays, and turns out she had some ligament damage that was making her neck unstable, for lack of a better word. So I'm like, well, adjusting you manually probably isn't going to be the best approach. We need to focus on getting your body to stabilize and strengthen. So the approach that I'm taking is, okay, if something is tight, why is it tight? If something is weak, why is it weak? Is there a nerve impingement? Is there damage? Is there a ligament strain? And it's not just about moving the bones, it's about finding out why the body is doing what it's doing. There's usually a reason sometimes, and again, we can sometimes figure it out, and sometimes it's not quite that simple. Traditional chiropractic adjustments work. It's still one of my, quick and easy and most effective ways to get at a problem, but sometimes it needs a little bit more finesse, and we need to dig a little bit deeper. If somebody's got chronic, pelvic instability, or that's what they've been told, but it's because of an old ankle injury that's unstable, it's making them walk funny, that's going to be a different approach as opposed to just adjusting them all the time.
Right. No, it's great. It's great. I mean, it makes a lot of sense. And it kind of speaks to this more holistic approach when you're actually looking at the individual and saying, okay, well, what have they not tried? What is different about what we can do for this person that's going to help encourage healing or encourage them to take that small step so that we can get some positive feedback loop into the picture. And sometimes if you're just doing the same thing all the time, you're missing an opportunity to really get in touch with what that individual needs. So that's beautiful.
Right. So yeah, working through my process, it's like, okay, why is your body doing this? Why does it hurt? Why is it doing this? What, again, going backward through that history, what's triggering this? And, addressing that instead of just trying to make it feel better all the time. It's like, yeah, sometimes we need that to get them started, but to fix the problem or at least make it a lot more manageable long-term, we need to take these other approaches too.
Yeah, it's great. It's like, anybody that's watching should understand that just because you've been to a chiropractor and it didn't work for you doesn't mean that there's not another approach. Just because you've been to an acupuncturist and it didn't work for you doesn't mean that there's not another provider out there that could make a difference. And so this is a perfect example. You're utilizing all these other kind of, I'm going to call them modalities, but techniques or whatever you want to call them to help someone, to help someone's body get triggered in a positive way. You know what I mean? And then capitalize on that and then move to the next step and then capitalize on that. And it goes back to this limiting belief piece that we started the conversation with. We don't need to have limiting beliefs. We just need to find what's going to help us get to the next level. And you're a great example of someone that can do that in so many ways.
Thanks. I try.
Yeah.
But yeah, I mean, the modalities, I've tried chiropractic and like you tried that chiropractor. It's just like going to a dentist. You might have a bad experience with a dentist, but that doesn't mean that you're going to have a bad experience with the next one. You still need the treatment. You still need to see the dentist. We just need to find one that works for you.
Definitely.
And I'm, at this point, I'm getting better at setting my ego aside when I'm like, I really don't know what's going on here, and I need some help. And the one thing that social media is good for is I've got bigger. I know where the bigger brains are hanging out, and I can always go poke at them and say, all right, I can't figure this out. What am I missing? Yeah. Or send them over to you or to the naturopath or to the nutritionist or to their therapist. I'm like, this stress stuff is really getting in the way of you getting better. So maybe we need to back off and let you go address that for a little while. Yeah. And that's perfectly fine. Whatever works is what is my approach.
Yeah. Yeah. Super cool. This is great. Oh, this is awesome. I mean, I want to keep going as I say at the end of most of these, but I know we can do this all day. Yeah. So let everybody know where to find you before we wrap up.
Okay, my office is Frederick Chiropractic Wellness Center. I'm over on Buckystown Pike, right by the exit from 270. So right next to the Hampton Inn is where you can find me. My website is www.frederickchiro.com. I'm on all the social media, thanks to my awesome social media person. I'm kind of new to this video podcast thing, and I'm looking forward to maybe expanding on that. But sure. So yeah, you can check out my website. You can contact us through the website. Feel free to email me, and I'm happy to answer questions and see if we can figure out if this is the right fit for you.
Very cool. Thank you so much, Deb. This has been a lot of fun. I look forward to continuing to collaborate as we go forward here in Frederick. And thank you so much. And for those of you who are watching and are still with us, make sure that you give us that thumbs up and like the video here. Comment on it. Let us know what else you'd like to hear about. And if you have any questions for Deb, just pop them into the comments section there. Share it with your friends. And thank you all for being here.
All right. Thank you.
All right. Thanks, guys. Take care.